There are multiple indications for use of lasers in pediatric patients with different skin conditions. Here at the Florida Society of Dermatologic Surgeons annual meeting in Orlando, Dr. Jan Izakovic presented his expertise. Can you tell me what you recommend in terms of lasers for port wine stain removal?
For port wine stain removals, I usually use the pumped dye lasers. They seem to be the most effective ones and the ones that have the broadest base of experience and of evidence for good results.
Okay, now you also talked about pediatric hemangiomas, and you talked about how parents are happy when they have the laser treatment. Can you talk about that?
Parents are very satisfied seeing that as a result of the laser treatment, the hemangioma, first of all, stops growing, and secondly, starts developing like grayish, whitish areas within it, which is officially believed to be the sign of involution, the starting sign, the first sign of involution. So if you see that, if you see the gray areas, the white areas within the purple or red areas, that's what gives you a hint that the hemangioma starts actually going back, involuting.
So even if someone is choosing to do combination therapy for hemangioma, it might be good to start with the laser, you're saying, because it reassures the parents that it's not getting any worse.
Absolutely, you're absolutely right, because it gives you a right away visual control of what's happening, and you can of course combine the two treatments, like treating the surface with the laser and addressing the deeper portions with a systemic treatment.
Okay. And you talked about nevi and how you can treat nevi with lasers also, but it's important to always check the histopathology of what you remove. Can you talk about why?
Well, that's what I believe and what many people from the European dermatological community where I come from believe in, that it should be kind of a rule that nevi should be checked histologically before you start talking about eventual removal. So if you use the lasers, and by this it's becoming a controversial issue because you'll find many people who actually advocate for laser removal because they believe it's a safe technology. So the point is that if you destroy the tissue with a laser, you can't check back what you destroyed because it's all gone. It's either evaporated or otherwise destroyed. So first point would be either making sure with a biopsy that the lesion you're treating is harmless, or removing it completely and having the option to check the whole tissue for its dignity.
This has been Damian McNamara reporting from Orlando.